Welcome back to another episode of the Lost Book of Herbal Remedies podcast. I'm Emma, and today we've got a comprehensive episode lined up. We'll be talking about one of the most widespread and debilitating conditions, chronic back pain.
Chronic back pain, or CBP, is an incredibly common issue that impacts millions of people worldwide. And it's not just a sore back. We're talking about persistent pain that can last for months or even years, often affecting every aspect of life. Today, we'll explore not only what causes it, but also how it ties into psychological factors like fear, new treatment options, and of course, some herbal remedies that can provide real relief.
That's right, Alex. This isn't just a physical issue. It's complex, and we're going to break it down for you, step by step. By the end of this episode, you'll have a better understanding of what causes chronic back pain, what new research is showing us, and what you can do to alleviate it naturally. So what exactly is chronic back pain? Essentially, it's any pain in the lower back that lasts for more than 3 months. It can be caused by a variety of factors, things like injuries, degenerative disc disease, and even psychological influences like stress and fear. It's a condition that can severely impact your quality of life by making even simple tasks like getting out of bed or picking up groceries difficult.
And the numbers are staggering. Chronic back pain is one of the leading causes of disability worldwide. But what makes it particularly challenging is how it affects more than just your physical health. It can lead to emotional stress, decreased productivity, and even social isolation because people might stop doing activities they love, like exercising or socializing, for fear of making their pain worse.
Let's dive into one of the key psychological factors in chronic back pain, pain-related fear. So this is when people who experience pain become afraid of doing things that might make the pain worse. Alex, what do we know about how this fear impacts daily movement?
Well, research shows that people with chronic low back pain tend to move differently from those without it. In a recent study, 49 patients with chronic back pain were compared to 51 healthy people. The patients were scared of making their pain worse, and this fear caused them to avoid normal activities, like bending down to pick things up, even if their body was capable of it.
Exactly. Imagine being so afraid of a painful flare-up that you stop bending over or lifting things. Over time, this fear can actually change the way you move, causing muscle stiffness and even making the pain worse. But here's the interesting part. The study found that fear doesn't always affect movement in the same way for every activity. So while fear might stop someone from picking up a box, it might not have the same effect on something like walking.
Right. And that's why it's so important to treat chronic back pain holistically. It's not just about treating the physical pain. We need to address the psychological side of it too. A big part of managing chronic back pain involves helping people overcome that fear so they can regain normal movement.
Now, let's switch gears and talk about one of the major physical contributors to chronic back pain, intervertebral disc degeneration, or IDD. Alex, can you explain what happens in the spine when IDD sets in?
Sure. Your spine is made up of bones called vertebrae, and between each vertebra is an intervertebral disc, which acts like a cushion or shock absorber. Over time, these discs can wear out or degenerate due to age, injury, or repetitive stress. When this happens, the discs lose their ability to provide cushioning, leading to pain, inflammation, and even more serious issues like herniated discs.
And when those discs degenerate, it's not just the pain we have to worry about. People with IDD often experience limited mobility, stiffness, and muscle tension because their spine doesn't have the support it needs. As we mentioned earlier, this can lead to even greater fear of movement, which makes everything worse.
Right. Now, most treatments like physical therapy or surgery focus on managing symptoms, but the real breakthrough comes from new regenerative therapies. These approaches like gene therapy or tissue-engineered constructs aim to repair or even reverse disc degeneration at its core. Imagine being able to restore the structural integrity of your spine. It could be a game changer for many people suffering from chronic back pain.
Let's not forget that chronic pain isn't the same for everyone. Different types of chronic pain affect the brain in different ways. For instance, did you know that people with chronic back pain and those with widespread pain show completely different brain activity patterns?
That's a really important point, Emma. Recent studies have found that people with chronic widespread pain have something called a higher peak alpha frequency, which is a measure of how sensitive they are to pain. Those with chronic back pain don't show the same PAF levels, suggesting that the brain processes these types of pain differently.
This is huge because it means we can't treat all chronic pain the same way. If someone's brain is wired to experience pain differently, their treatment plan needs to be personalized. A one-size-fits-all approach just doesn't cut it.
Let's talk about one of the more promising treatment options, Osteopathic Manipulative Treatment, or OMT. Emma, can you explain what OMT is and why it's gaining popularity?
OMT is a hands-on technique where osteopathic physicians use their hands to move muscles and joints to relieve pain. But what's really fascinating is that OMT doesn't just affect the body, it also changes how the brain processes pain. Studies show that OMT can reduce the connectivity in areas of the brain associated with pain processing, which lowers the overall pain perception.
So it's like a double whammy, addressing both the physical alignment and the brain's response to pain.
Exactly. What's amazing is that OMT has been shown to improve brain connectivity in regions responsible for emotional responses to pain. So not only does it relieve physical discomfort, but it can also help people feel less emotionally distressed by their pain. Another exciting therapy for chronic back pain is electrical dry needling, or EDN. This method involves inserting fine needles into specific trigger points in the muscles, places where the muscle tightens up, and then applying a small electrical current. This helps relax the muscle and improve blood flow.
What's really interesting about EDN is how effective it is for patients with chronic low back pain, especially when compared to traditional physiotherapy. One study showed that patients who received EDN had greater pain relief and improved function than those who only did standard therapies like stretching or compression.
For people suffering from chronic pain, it's incredible to think that a simple, non-invasive technique like dry needling could make such a big difference. And now, for my favorite part, the herbal remedies. Let's dive into some natural options that can help alleviate chronic back pain and even support disc health.
First up is turmeric, which contains curcumin, a powerful anti-inflammatory compound. Turmeric is great for reducing the oxidative stress and inflammation that contributes to disc degeneration.
Next, we have white willow bark, which is often referred to as nature's aspirin. It contains salicin, which can reduce pain, especially for those dealing with intervertebral disc issues or myofascial pain.
And don't forget Resveratrol from Japanese knotweed. Resveratrol is a potent antioxidant that protects against disc degeneration by fighting inflammation and oxidative stress.
Another herb that's gaining attention is Boswellia serrata, known for its ability to reduce inflammation around degenerated discs. It can help with the pain and stiffness that comes with IDD.
For those with more severe pain, devil's claw is a great option. It's traditionally used for its strong pain-relieving properties. And to manage the stress and anxiety that often come with chronic pain, Relora, a blend of magnolia and philodendron, can be very helpful.
And of course, we have ashwagandha, an adaptogen that helps the body manage stress, and ginger, which works wonders for reducing inflammation and oxidative stress in the discs. Chronic back pain is a multifaceted condition, but understanding its underlying causes, from fear-related movement to disc degeneration, is key to finding relief.
Exactly. Whether it's innovative treatments like OMT and EDN, or using herbal remedies like turmeric and boswellia, there are a lot of options available to help manage and improve the quality of life for people with chronic back pain.
And remember, always consult with a healthcare provider before starting any new treatment, especially when incorporating herbal remedies. It's all about finding the right combination of therapies that works for you.
Thanks for tuning in, everyone. Be sure to check out the full article at herbalbloom.org for even more insights on managing chronic back pain. Take care.